Hello, we are here today with Omar Gray, the VP of Acute Care Operations. Welcome, Omar. Great to see you today.
Hey, hi, Deb. Thanks for having me.
You're very welcome. We're going to explore how you can leverage key revenue cycle metrics today. Very important topic. That's not only because they're important for day-to-day performance at hospitals and health systems, but they also provide the hospital and the practice management insight into how the organization is operating. And today that is more crucial than ever before. So let's start, Omar, by asking you, what revenue cycle metrics are key metrics within the health system or the hospital?
Yeah, Deb, here's what I will say, and I'll name a few core ones here. Starting out with cash. Cash is king, and so understanding cash collected versus target, is extremely important, right? It provides, or you're able to gauge how effectively you're collecting against net patient service revenue. And then from there, you'll also get a solid pulse on reimbursement, right? I would also list as my number two is days in AR. I think that's extremely important because it also, days in AR provides a layout of how you're performing, how you're churning through AR, what's giving you headaches along the way as you continue to serve your community or patients. My number three is denials. Denials are extremely important as well, right? If you think about denials, it's almost like burning the candle at both ends, right? You have your initial denials, which is your inflow, and you have your write-offs, and it's where you're truly unsuccessful with getting paid on that particular claim from a payer. And then my fourth one, I'm a bucket two together, which is bad debt and charity. And that's really patient-centric. And that's really getting a gauge or understanding how well are you collecting from your patients, ensuring that they know their patient responsibility up front prior to them having their service. But it also takes a deep dive to provide insight on how well your financial counseling program is effective.
Interesting that you include bad debt and charity care, because I think many hospitals across the country saw that increase exponentially since COVID hit, with patients who didn't have insurance but were extremely sick and needed to go into the hospital anyway. And there's no saying no, right? There's only getting hit on the bottom line.
You're exactly right. And, I think kind of twofold, right? You saw the government provide some subsidies to hospital, but you're absolutely right. You had, healthcare became really, really tricky to understand what was COVID related and understanding how you distinguish or what you could bill the patient for. And so you really had to, embed or input some controls within operations to really drive and be effective.
Absolutely. Tell us what should be considered some of the drivers within these metrics, specifically for revenue cycle purposes, like, KPI.
Yeah, absolutely. Yeah, definitely having some strong KPIs are important. Just starting out with AR for an example. Having strong business analytics or business intelligence tools to really drive results, to be able to harness your AR and break it out in 30-day increments to understand where there's growth. Are you successful? What's providing headaches? What works well? What doesn't? Is extremely important. For an example, I'll use DNFB, which is discharge not final billed. And I like to think about DNFB as broken out in three components, right? You have your coding area embedded within this DNFB. You have your deficiencies or documentation deficiencies, which could be physician documentation, which has to be there to code. And then you have your other technical components. You could have edits or other pre-edit items built within that clogs the younger AR up, and you need to be able to drive or identify what that number or what that day would be within that DNFB to ensure your young AR is clean to get a claim on the door to the payer as fast as possible. So those are a few examples. But another indicator or lever that I always like to kind of throw in there is your relationships. And I think your relationships are both important internally and externally. And internally could be the nurse, the physician, and externally would be more or less the payer, right? Having those payer reps on speed dial or having someone that can help you with a bulk issue or a unique issue to get your claim processed.
So you mentioned coding. I'm very curious, and I know we have a lot to get to, but I'm curious. When it comes to coding, what do you see with your clients across the country? Because, when the coding system changed and it seemed that there were a lot of people who weren't trained, they didn't catch up. There were multiple different codes that got them caught up and they were losing money there. Have people caught up with training on the coding?
I think it's a hodgepodge, and again, I think it's an effective it's more proactive how proactive you are. So if you really plan for it, gear your coding team up to what's underway, have really strong tools or from an upgrade perspective, right? I mean, we've seen it in Epic, Cerner, 3M. Depending on what that tool is. It takes a village, right? And so if you have a real strong rigor within your training program and, leverage leadership, CDI, specific things that tends to stick out along the way, you can be much more effective and proactive as changes occur.
In your earlier answer, you mentioned physicians and nurses as partners in the process, and that's another whole webinar actually. But could you just give us a brief overview of what you see as the important role they play as partners?
Absolutely. So if you think about it from a metrical standpoint, right? I mean, you get a long length of stay. And as that coder is actually churning through that chart to get it coded, and they just realize, hey, I'm missing an H&P, I'm missing a discharge summary. That documentation is critical and important to have at hand at the point of, I'm gonna call it past suspense, to be able to, to code whatever is needed based on those services rendered. If it's not there, things tend to age out. And we know that physicians and providers are busy. So, we don't want it to become out of sight, out of mind for them. To whereas, things go so far in age that, now we're at 30 days. And a lot of organizations, they try to, embed controls such as like deficiency policies for physicians, right? To say, okay, hey, you have X number of days to get this document in, depending on that, point of care, whether it's an ED visit or an inpatient visit. Things of such are really important, right? Not having an order is huge. Payers have become really, really tactical and delaying payment of claim by doing pre and post audit. And so if that documentation isn't there when they make that request, things from an AR perspective begin to age out. And so, everyone in healthcare knows the longer it takes to get paid on it, the likelihood of getting paid on it becomes very slim. So if you're able to churn through and have the appropriate controls and as effective as possible up front, you have a better success rate of getting paid on your claims.
We'll tag you for a webinar and all of that. That will be next up. But we'll pay attention to the topic at hand today, which is revenue cycle and key metrics. So tell us, what are some of the typical challenges, and there are many, that health systems and hospitals are experiencing today with these key metrics? And I know we can ask you to speak to two in particular, AR deterioration and denial management.
Absolutely. Starting with AR deterioration, I think we've seen a lot through the pandemic. One that's really prevalent in the market right now, and I've seen it with quite a few commercial payers, is the pre and post audit. And the many examples go like this. It's you get a 25K claim. The payer is asking for a medical record or itemized bill each encounter. Their process isn't really geared to electronically process it on their end. And so it's almost a snail mail process if you can't upload the documentation into their portal, or you're not allowed to even send the documentation until they request it. And so, that one it's a monster, right? And if you think about it, if you have to wait on them to process it, right? Payers, were plagued with the same staffing challenges we saw in terms of with the pandemic, right? We were short staffed, having to work from the hospital side. They are as well. And so, when you put tactical traps in there, it makes it, that's AR deterioration. And so you have to figure out how to be effective and, work with that payer and say, hey, look, we need to probably call an audible on what you're trying to institute or deploy to do these audits, until you can kind of get things in sync on your end. But on the flip side is you just have to have those working relationships with the payer to be effective there, and also work with your managed care or payer contracting team as well.
Excellent.
Let's see.
Yeah, I think relationships are everything, aren't they?
Absolutely, for sure.
So what about
Yeah, I mean, you
denial
also mentioned,
management?
yeah, with denial management, some pointers there, again, burning that candle at both ends, right? So understanding inflow, I would really, I always use the term based on my earlier consultant days, is a Six Sigma acronym called MEG, right? And that's define, measure, analyze, improve, and control. And so, denials are health systems, health organizations, one of their biggest headaches are uncompensated care items. And what I would say here is that understanding your root cause from an initial denial perspective would be your first start. But you also have to, bring in your group of stakeholders, right? It could be your physician, it could be you're getting in, a doctor orders a test or diagnostic test with contrast and realize he didn't really need contrast. Well, at this time, you've already got the one with contrast authorized. And so, at this point of bill, they may or may not pay it because what you service wasn't what you had authorized. And so, you really have to hone on those type of things to really understand from a stakeholder perspective, who do I bring into this party? Who do I invite to this party to understand how can we change the process, the behavior, that type of thing to really be able to drive results. But also understand where you've been by reviewing write-offs to understand where you need to go, because that's really going to be your opportunity. And, once you're able to go in and I'm going to, using the I, make those improvements, as well as to C, provide some controls to be able to, to turn the ship around. I think that's really, really important. And that works, from authorizations to timely filing, ensuring you have the right controls, technology in place to provide alerts to say, okay, hey, this bill is needs to be out in 90 days. Here we are approaching day 88 and we hadn't gotten a claim out of the door because we're missing something. So again, it takes a village. But again, being able to know where you've been to understand where you need to go.
So what kind of platform is best suited to give them that kind of, it sounds like that's data-based. And what is the roadmap? I love your analogy. You need to know where you were to know where you need to go, but what do they use as the map? I mean, you just mentioned a couple of things, alerts, but it seems to me that you would have to have a strong technology platform in there.
Absolutely. So I would say your analytic tools needs to be really robust, right? And most organizations, they attempt to leverage, what they have internally, and a lot of that comes from whatever EMR they're using, right? So there's specific reporting associated in your Cerner systems or your Epics of the world, and then some simply just use agnostic tools. Here at Infinix, we're really good at what we do from an analytic perspective. And when we go in and do assessments, we get that data from the client and kind of harnessing on those opportunities to say, okay, hey, looks like there's some opportunity here from a denial front, or if we're looking at DNFB days and we go through it. If you think about that 3-component breakout of deficiency, coding, and the other component from a technical standpoint, we look at those specific things to say, okay, hey, look, we put targets within our analytic tools. We make assessments and recommendations based on what we're able to utilize there. But what I would say is, if you don't have a great business partner that have strong agnostic tools to be able to support your organization, I would definitely lean on that as a solution, right? There's a lot of optimal things that can be done to really drive some results.
So if we move to talk about tactical practices, you were just talking about the fact that payers are really leaning on tactical strategies to up their game. What about healthcare organizations so they can get in front of the underperforming metrics if they've gone through the analysis process?
Yeah. So there, I would say, again, use my acronym, DMAIC, right? There needs to be a definition to really get to an ultimate goal, but know where you want to go again too as well. And so to get in front of an underperforming metric, pulling those stakeholders, have some really solid analytics to drive what's not occurring in your world that you need to happen. Having those goals outlined within your KPIs are really important, because you never can be effective if you're experiencing a AR aging problem because you're not meeting timely filing. So everything you're submitting to the payer it meeting that criteria. And so you heard me throw out a couple nuggets earlier, like you don't have the appropriate tools to prompt alerts. When the wrong insurance is loaded, and there's another insurance that should be primary that would deter getting that claim to the appropriate primary payer on time. You really have to jog through and really figure out, who should be within the stakeholder setting, what tools you should leverage, and what operational features or enhancements should be made to really drive the results, right? So, people, process, and technology, get your gaps assessed where you think you may have opportunity, whether that's leaning on a new business partner, or understanding, what expertise you feel exists or does not exist within your organization to really help drive those results. So, those are a few pointers that I see where, if an organization is struggling with issues as such, that can really help harness or promote some betterment.
I think get your gaps assessed is really the headline. Kind of
Correct.
jumps off the page, right? That and needing a map. Before we go to the next question, I wanted to invite our attendees. First of all, thank you very much for joining us today. And if you have questions, please type them in the chat box, and we will get to them at the end of the discussion. So can you go into a little bit of detail for us on who the stakeholders are? We've mentioned physicians and nurses, but who else do you think are the key stakeholders within, let's say, an acute care hospital?
Absolutely. I think it's your CFOs or your C-suite, your presidents, Definitely your finance team, of course, right? They have a real keen sense into your cost to collect, right? And or in terms of what services truly cost for that organization, right? To ensure that, hey, you're maximizing your reimbursement, but as well as being effective. And when you get to the effective piece of the stakeholder equation, that's when you bring in your clinical leaders, right? It's your surgery directors, your physician offices or physicians, right? Because they're our partners too, where the actual order comes from there. And so there could be opportunities within, completely at the beginning from a scheduling front, to make sure the best patient experience there, right? Because if you don't have patients, you don't have revenue. And so ensuring that best patient experience from a patient access front, that everything is being captured, driving results there could be really critical to make sure that you're bolstering your revenue, right? Hypothetically, a CFO will look at it and say, hey, look, looks like we performed, 1,300 CTs last month. How do we better that? How do we ensure that we're getting the best patient experience to get to 1,500 if the capacity or bandwidth allows it? So serving your community. So everything has to click and work accordingly. And so you have to push, pull, and drag your stakeholders to make sure you got a complete set to really drive results.
Yeah, I was just going to ask you, what % of the time do you see that you have all of those stakeholders at the table? Dragging, kicking, and screaming, right?
Absolutely. And sometimes it's simply, passing that physician or passing that office manager in the hallways, right? And say, at the Starbucks or over a cup of coffee or something like that. But, making that outreach, but being effective to ensure that, you have strong results or examples to provide is really key, right? Because, you may approach them and you may find that, hey, they're not the stakeholder that should be there. It could be some system, some vendor they're using, et cetera, some technical component or interface driving an issue. So you would be surprised having the examples, how much you can unarchive and really make some traction on the problem.
Yeah, those are great examples. Thank you. We have a couple of questions, but I want to ask you one more. What are the parameters or the controls that you think should be considered when a hospital or a healthcare system wants to drive and sustain improvements that they may now be obtaining in these metrics after they've gone through these steps and tactics?
Yeah, I would say from a stakeholder perspective, meet frequently, right, with those stakeholders, build relationships, and that's strategic, functional, and personal, right? I mean, I think, again, you heard me use the phrase, it takes a village, and it truly does. And then leverage a strong business partner if you feel that operational expertise doesn't exist as you do your gap assessment. Infinx, we're happy to come out and look over your operations and make some recommendations. So, but ultimately, develop a plan. I mean, you really have to have a plan and a goal that you would like to achieve based on where you think opportunity exists. And then I would lastly would say strong analytics or reporting. I think that is really, truly significant. I mean, you said it best. A lot of this is data driven, and if you don't understand what's ailing or failing, it's really hard to understand where you need to go.
Excellent, thank you. So we have a question, a couple of questions here. What would be the appropriate cadence to visit these metrics? I think that's a really important point. Healthcare sometimes moves like a snail. And in addition to cadence, are there any other factors that should be considered?
Yeah, for those core metrics that I mentioned, month to month is pretty standard. But I would also look, quarter over quarter, right? From an AR perspective, month to month is pretty key. Cash is daily. Nows would be monthly, right? Just to ensure that you're really inching in the right direction to drive results. And then from a bad debt or charity perspective, I would also look at that as monthly as well. And then over time, between your AR metrics, your cash, and your compensated care metrics, you also want to look quarterly and annually to understand how you compared or performed against the previous year or quarter, right? It just, gives you perspective or insight to ensure that you're moving in the right direction.
Absolutely. So here we have another question here. We've had a tough go of it since 2019 from a hospital standpoint. Any pointers on how to jumpstart AR with a severely reduced staff?
Absolutely. We've definitely seen a lot of that, both on the health system side and the payer side. I would definitely say lean on a business partner. There's scale there. There's the optimization point of, hey, we've seen it all, done it all, been there before, and we can also share what works. So leverage a business partner where you've seen a reduction in workforce. So we can definitely help with that.
I think there's one more question here about the analytics that and some of the data that these tactics will produce for hospitals and healthcare systems, and the fact that as charity care has begun to increase in some states, the attorney generals are looking at those reports and they're asking why it's increasing. Can you give us any insight into how key metrics will help to answer those questions?
Absolutely. Yeah. So understanding, you probably heard me mention earlier that, patient responsibility, even when a patient has insurance, so the patient responsibility portion is increasing. So, looking at rigor into your financial counseling program could be one of them, right? But understanding what that ratio of payer versus patient is based on what's being pushed to the patient is important, right? You can actually track if you have really strong business analytics tools, how much of that patient responsibility has grown over time.